Okay, everybody, this is part two. Part two is even more interesting than part one. And what we're going to do in part two is we're going to continue to talk about some of the things that we were dealing with, but I want to make it very clear to everybody again that oxygen is the most important element our body uses. If we do not have it, every 300 or so seconds, our body will not function and we will, what we call, die. And that's not a good thing. So oxygen becomes then the most important element in our body. And the level to which we use it, we call it dosing. Whether it's little oxygen, medium oxygen, a lot of oxygen, we dose to a certain disease, just like a physician would do to someone who had an infection. If you're a certain size and you have a certain infection, you might get 100 milligrams of Cipro once or twice a day. If you have a more horrific problem, a more horrific infection, you may well then have 300 or 400 or 500 milligrams a day, or maybe 300 milligrams twice a day, because you're dosing to the situation. That's what we have to do. And that is important to know, because oxygen is dosable. And how do you make it dosable? Number one, by the time you're in the chamber, the longer you're in the chamber, the more oxygen you're getting, and the pressure, because the pressure in the chamber determines a level of oxygen that will dissolve. Now people say, well, what does that mean? Here's what it means. It's the same thing that happens at the Coca-Cola bottling company. If you have a Coca-Cola bottle and you open it, you shake it a little bit and open it, what happens? It fizzes. It fizzes. Why does it fizz? Because it has a gas dissolved in it. Carbon dioxide is dissolved into the Coke. How does that happen? The Coke is put under pressure in the presence of a gas called carbon dioxide. The pressure causes the gas to dissolve into the liquid. It's immediately capped, and you have a bottle with pressure in it, and what happens when you open it? It comes out. Well, when you go in the hyperbaric chamber, you're like the Coke. And when we apply pressure and a gas called oxygen, the pressure causes the gas called oxygen to dissolve into every bodily fluid. So your blood is absolutely full of oxygen, and that's how it works, and it's a very, very easy principle. Hyperbaric oxygen has been around. It's not a newfangled therapy. It's been around since 1662, and there are historical records of them using pressurized chambers that they made, and they had iron casters in those days, and they could make them. So this is a reality. It's not a fantasy. Hyperbaric oxygen has been utilized, although they didn't quite understand everything they were doing, but we're looking at hundreds of years. This is an old therapy, and it's kind of a forgotten therapy in some sense, although it's coming into its own now, but it is a very efficient way to heal, and it causes the entire healing mechanism of a human body to go into healing mode, and it will accelerate almost any healing that you are trying to do, almost any healing, especially muscular healings, sprains, athletic injuries, any kind of injury. The healing can be accelerated dramatically, and we estimate usually we can get you back in the game if you're an NFL player, in about half the time, in about one half the time. So as I said before, if the doctor says you need to be on the bench for a month, we can usually get you back in 2 weeks, which means a lot of money for those guys.
Not a cancer patient.
Cancer is a very interesting subject when it comes to hyperbarics. There's not a lot of knowledge about the relationship between oxygen and cancer, but there is enough to know that there has been some research done, and Dr. Otto Warburg many years ago discovered not that cancer cells are killed by oxygen, or not that cancer cells won't replicate in the presence of oxygen, but he discovered, and won, by the way, a Nobel Prize in medicine for it in 1930, a long time ago, and he discovered that there was certain difficulties when oxygen and cancer were present together. Certain difficulties, and those difficulties are still not totally understood, but it is assumed that there is a difficulty somehow in cancer cell replicating, or that cancer cell replication may well be slowed down by the use of oxygen. Now, it's not regular oxygen that I'm talking about. It's oxygen under pressure, because what happens when you put it under pressure, you get a lot more of the oxygen gas dissolved into the blood, just like if you use a lot of pressure to do a Coca-Cola bottle and fill it with carbon dioxide, you can get a lot more carbon dioxide in the Coke if you have more pressure. And that's kind of what happens. So during the time period of 1662 until now, it's taken a long time for this modality in medicine to really catch on and be utilized. And now almost every hospital has hyperbaric oxygen therapy available. The hospitals treat only 14 out of about 200 different possibilities that can be treated with hyperbarics, because they only pay for what, or they only treat what insurance will pay for, only what insurance will pay for. And insurance will only at this point pay for a small number, 14 out of 200. However, you must remember something very interesting, and that is that the hospitals charge a lot of money for their treatments. And I'm not going to name any name, but one of the greatest hospitals in the Los Angeles area will bill you $2,080 per treatment. $2,080 per treatment. And insurance will help cover that. They're certainly not going to pay the whole thing. If it's one of the 14 or 13 or 14 conditions. But the thing is, those conditions will all lead to either death or massive, massive problems that will cost a whole lot more. For example, if somebody has a diabetic condition and they have a leg that needs to be amputated and it's really bad, replacing the leg with an artificial leg from diagnosis all the way through installation and utilization and training of how to walk with a fake leg is about $145,000. That's a lot of money. Most of those patients can be treated in a hyperbaric chamber and their leg can be saved. And you know what? It may cost $8,000 or $9,000 to do that. But guess what? It's never caught on. It's never caught on. And there are a lot of things like that. Because sometimes, you know, the money in the big industries get to the point where we don't really want to look for anything else. This is working. It's working. And it's okay. And the insurance companies pay for it, so it's not a big deal, and they don't worry about it. But there are a lot of ways to bring the costs down with using hyperbaric oxygen. For example, at the Center for New Medicine, we use hyperbaric oxygen, and the price for a treatment there is around $200 a treatment, and it goes down with the number of treatments. And that's a far cry from $2,080 a treatment. Question?
So how safe is hyperbaric treatment for a child with bronchial asthma or severe autism? How safe is it for a child?
That's a good question. Autism is not a problem for safety. Autism is not a problem that manifests problems in the area of the lungs, so it's not much of a problem. We teach the kid how, and we have autistic kids are wonderful. They're wonderful. I would invite anybody to come and see, and they get used to being in the chamber. And I've got one little kid who's 5 years old, and when his mom brings him to the chamber, he runs to the chamber door and tries to open it. And I said to him one time, David, why are you trying to get in there? It makes me better. A little 5-year-old kid said that to me. I almost started to cry. It makes me better because he knows, he feels, he can function better. And that's a wonderful thing. Very safe, not a problem. Other issues that have to do with the lungs can be a problem. We have to assess the pressure. We have to look at what the pressure might do to exacerbate and cause a problem in the lungs that might be uncomfortable or even unsafe. And so we do that in every single case. And those are the two answers to the questions, and I hope they're okay.